So, continuing the discussion around workplace bullying, we'll have Michelle Tuckey and Catherine Doherty add to the conversation. Then we'll have some more time for discussion. So, Associate Professor Michelle Tuckey is our South Australian leader who has made a significant research contribution to prevention of bullying in the workplace. And also Catherine Doherty is here from Beyond Blue, who's our Workplace Engagement Manager. There was reference earlier to Lifeline and Beyond Blue. They are both national organisations, so it doesn't matter what state you're in, you can always contact those agencies. So I'll first of all invite Michelle up to the stage for 20 minutes, and then we'll have Catherine following straight after. So thank you, Michelle.
Thanks very much. I'm really glad to be here today with my good friends Damien and Ray. I remember the first plumbers' hugs and the very first time we met. I don't even think we'd spoken, but after I'd given my presentation, we had the biggest hug, and we've been friends ever since because we're aligned on this really important issue about preventing workplace bullying. So before I start, I'd like to acknowledge a fantastic group of people that I've worked with at UniSA and beyond to do this research, to go from like some theoretical ideas about how we should tackle bullying right through now to some really practical solutions and tools that we can use in workplaces. And also like to acknowledge our funders, so funding from the Australian Government through the Research Council. Safe Work SA has been a really big supporter, and in fact the major supporter of this line of work that I'm going to talk about today. The Nursing and Midwifery Federation in SA, and also Safe Work New South Wales, so thank you so much. So we heard in the talk by Ray and Damien what workplace bullying is, and so that's the definition under our legislation, which he went through really well. We also heard, of course, about the terrible, terrible effects of workplace bullying, and you know, if we're all here because we're interested in creating mentally healthy workplaces, but their story is so powerful just to illustrate why this issue is just so important. In Australia, we have a really reasonably high level of workplace bullying. So 1 in 10 workers have been, you know, reasonably seriously bullied at work on a regular basis over a long period of time, to the extent that it creates a risk to their health and safety. And there's a whole lot more workers who are exposed to bullying on a more incidental or more occasional basis. But 1 in 10 are experiencing this in an ongoing way to the point where it impacts on their life. So that rate, 1 in 10, puts us above 34 EU countries. So if we compare to those comparators in Europe, the Australian rate is higher, and it's increased since 2009-2011. So this is based on reliable national survey data. You can find the full report on the Safe Work Australia website. So what I'm going to do today is share with you 3 key ideas that I think are really important to take away to prevent workplace bullying and create a mentally healthy workplace. The first idea that I want you to take home is that workplace bullying is not an interpersonal problem. Even though it plays out amongst workers and between workers, it's not just a problem of personality conflicts. Bullying is actually a systems issue. So if we look across all of the scientific evidence, and there's been at least about 164 international studies on what are the things that contribute to bullying in workplaces, we can see without a doubt that organisational factors are so much more important than individual factors, anything to do with the target, or even anything to do most of the time with the perpetrators. It comes from the workplace systems and stress in the organisational system. So when there's really high demands, if it's a high pressure environment, you've got to work really fast, really hard, really tight deadlines, particularly when there's unclear roles and responsibilities, so the boundaries of roles aren't clear, or you've got conflicting expectations of you as a worker from different people. This creates this fertile soil for workplace bullying. Lack of control makes things worse. You know, people can't control when and how they do their work, and that makes them vulnerable to bullying. And the lack of resources to go around, everything from tangible resources that we need to get the work done, like tools, computers, right through to the number of people, if there's not enough people to get the work done. Now, as we've heard all too clearly in Brodie's story, bullying is tolerated and reinforced depending on the organisational culture. So if you build a resilient culture, then bullying doesn't have a place to thrive. And this is a really, really important message to take home. It's got to come from the top down. It has to come from the very senior levels in the organisation that bullying is just not what can be done around here. So if we take all of these things together, it's really clear from the scientific evidence, as well as from the stories that we've heard today, that bullying is actually a symptom of dysfunction in an organisation. It's not the disease. I mean, it is a disease, but we can't just focus on bullying behaviour. If we really want to tackle bullying, we have to go right down to that underneath layer, just what is going on in the organisational culture, in the organisational systems and structures that allows bullying to take place, that kind of allows people to turn a blind eye, and where there's no action is taken with the bullies. Now, even though we know all of this, and we've known all of this, for quite some time in terms of the research, when we look at what actually happens for bullying prevention in organisations, bullying is still primarily tackled as an individual level issue. So let's think about some of the actions that employers and employees can take to prevent bullying. I've listed a whole lot of them up here, and the ones that I think are really common are in green. So develop and publicise a bullying code of conduct. Oh, I don't think that works on there. That's really common these days, have a workplace bullying policy or a behavioural conduct. Educate employees about bullying harassment. And I'm a supporter of mandatory education and awareness, absolutely. But then what happens is workplaces might say, okay, we've got our policy, you've done the training, be nice to each other. It doesn't happen. It's not enough. Then if you are bullied, you're supposed to put up your hand and report it so that something can be done. How can you report it in such a toxic workplace environment? So when we look at these different options for tackling bullying, and I think they're all important and necessary parts of the solution, what we see is that they all have that focus on the individual. They all put the emphasis on the individual worker. And if you're a target, it can be much too hard to report it. And it doesn't recognise the risks that are inherent in the organisational system itself. So really what we need to be doing is focusing our efforts in the top right corner here on identifying and reducing the organisational risk conditions for workplace bullying. We need to be providing a safe system of work that's free from bullying and harassment. So the research that I've been working on, and in particular, over the last 13 or 14 years, but in particular over the last 5 years, is really about coming up with a solution. How can we design our workplace bullying through risk management? So in the occupational health and safety space, risk management is not a new idea. If you're working at a height, we need to take measures to correct and control the risk of a fall and the potential consequences. We can actually manage workplace bullying in much the same way with much the same framework. The problem that we have, though, is that there's not a lot of good evidence to know how to go from these general understandings about what happens in workplaces through to these practical workplace tools that we need to do the risk management of bullying. It's not an easy thing to manage risks to mental health as it is to manage risks to physical health. So to try and bridge this gap between what we know and what we need to know to get these tools that can be used in practice, we actually analysed real-life workplace bullying complaints that were lodged with Safe Work South Australia between 2010 and 2013. So these were all de-identified so that they would be anonymous, and they were released to us for analysis. So about 5,500 pages of information my research team went through over the course of about a year to try and learn what is going on in organisational systems that allows bullying to take place when people feel bullied at work. What we discovered is that there's 3 real risk areas, or what we call the risk contexts, for workplace bullying. Okay, so when things don't go well around how working hours are coordinated and administrated, people can feel bullied. Managing work performance is a huge area where people can feel mistreated and bullied. And then the way that individual relationships are shaped with individuals and teams in the work environment. So coordinating and administrating working hours, that reminds me of a case of a nurse who was rostered on every single public holiday around the Christmas period, Christmas and New Year's, even though she had her family visiting from England. And she ended up in tears. And so this one-off thing might not have been bullying, but this was part of a pattern of similar behaviours that she'd been subjected to over a long period of time in that particular hospital. Managing work performance, we saw cases in which workers said things like, oh, you don't get any feedback at all unless it's bad. So there's just a lot of criticism going on, right through to workers that were yelled at and belittled and humiliated in front of other people when they'd made a mistake, even though they might not have been even trained for the work that they were doing. They've been asked to do something well outside their job role, well above what they had the experience for, and then they get crucified for it. In the area of shaping relationships in the work environment, one complainant wrote about the bully, well, she'd greet everyone else and be friendly with everyone else, but would completely ignore me. So there was an obvious divide between the way I was treated and the way the rest were treated. So that very same thing has happened to me. So I've been bullied in the workplace when I was around 17 years old. Actually, I was being bullied again in the university context too. So no one is immune. It can happen to anyone, and it very much depends on the work environment. Now, what we've been doing is looking at that framework and comparing it to cases that come before the Fair Work Commission. So workers or certain groups of workers can apply for a stop bullying order to the Fair Work Commission. And we've been analysing whether the sort of complaints that they make, and particularly the incidents of bullying that are upheld by the Commission, how do they align with the framework that's come out of the workplace bullying cases lodged by South Australian workers. So here's one example of a teacher. The teacher is also the work health and safety representative, pushed to introduce the workplace bullying policy. And then after that happened, and she had to take it further because the principal wouldn't update the policy, she started to become bullied by the principal. So 16 different alleged instances of bullying behaviour were submitted to the Fair Work Commission, and the Fair Work Commission agreed that 4 of those counts represented unreasonable behaviour that created a risk to health and safety. And those 4 different incidents actually align very closely with that framework that came out of the workplace bullying cases. So the principal involved the new business manager in the performance appraisal of this teacher, even though there was a history of conflict between those 2 individuals, and there was no grounds for that person to be involved in the performance discussion. The teacher was yelled at aggressively that her long service leave payment hadn't been approved when in fact it actually had. When she came back from long service leave, she was required to undergo induction training, even though there was no basis for this in policy or procedure or practice. And she was assigned a less experienced mentor without actually any demonstrable need for mentoring and upskilling. So we can see that this framework is perhaps resonating in what's still coming forward to the Fair Work Commission, but that analysis is ongoing. So it's very clear from our analysis of the cases that bullying primarily manifests through these everyday work activities that we see in these 3 areas. And so the bad news from that, I guess, is it can sometimes be really hard to recognise or name as bullying or know what to do, because it's coming out in all sorts of places in day-to-day working life, with how shifts are allocated and how breaks are allocated and who gets what leave when and what kind of feedback is given and who gets to go on what training course. It can be really hard to manage when it's manifesting in those ways. But the good news is that those areas can provide a really clear focal point for the risk management of workplace bullying in a proactive way and in a preventative way. So that's what my research in the last 5 years has been tackling, is actually to turn those 3 risk areas and those 11 different more focused domains into a workplace bullying risk audit tool. We now have a paper version. And just under development and testing at the moment is a website version as well. And so what we've done is actually evaluated the predictive ability, can we actually learn anything about the likelihood of bullying from using this tool? We went to 25 different hospital wards. We got workers to complete the tool, about 230 workers. We asked them about their exposure to bullying, And we also got access to hospital records that were really independent of our study to see, could we learn anything about the risk based on this independent data held in the safety learning system, held on the hospital database. What we discovered is that the tool can actually discriminate between high, medium and low risk teams based on that independent data. So we could work out in advance which were the high, medium and low risk teams, and then we look at the scores on the tool, and our tool very clearly discriminates, where those risks are. It can also predict, where the bullying exposure is, and that's over and above those other sort of workplace risks like high demands and low resources and unclear roles that I talked about earlier. So really promising evidence around the value of this tool. And I think that's because it comes from 342 real-life cases, so it's very much grounded, not in an academic type of research, of surveys, but really on the words of South Australian workers and their experiences, and it's come from that place. And we've taken it through a rigorous research process to get to where we are today. Safe Work New South Wales inspectors have been trialling the tool when they go out to investigate psychosocial hazards. And so from our interviews with those inspectors, they're talking about how it enhances their response capability. So they feel like it's a more objective assessment of the risks, which they find really helpful to be able to give feedback and areas to improve back to the organisations. They really like the systems orientation and the idea that we need to look at the inherent risks in the system rather than looking at people's behaviour, which is right down the end of the chain. And the tool actually highlights really specific areas for action that workplace can actually take steps to improve. They feel like it helps them be more focused and efficient in their investigations as well, and it's a really quick and easy implementation. So where do we go from here? What are some take-home points in terms of how we can control the risks of workplace bullying that I've learnt about in my research? Well, the first one, and the most obvious one, might be supervisory behaviour. But I'm really reticent to go, okay, workers, be nice to each other, to, okay, supervisors, be nice to your workers. That's really important, but it's just not sustainable without a good workplace system and culture. Nonetheless, we could do some things to actually improve the way that supervisors and managers go about managing and leading their teams, the way they go about giving feedback and doing performance appraisals and managing performance. So skills in those three risk areas here, coordinating and administrating working hours, managing performance and the way they lead in terms of relationships in the work environment. We can train up supervisors to be better in those areas. We can also work with employees as well to actually understand what the job role of supervisors is. We can think about assertiveness conversation skills training. So where there are conflicts and things that emerge, people can take early action to resolve them before they turn into ongoing issues. But the main area that I'd really like to see action in is these organisational systems and processes and structures. So there's a whole lot of things that could be done to actually change what happens in those three workplace bullying risk contexts. I've been doing some work at Long Bay Prison in New South Wales, and they're actually changing the supervision model. So rather than just whoever's most senior on the day becomes the leader of the team, they're creating team structures that have accountability and clear roles, reducing that role ambiguity and role conflict and providing better training to those people. So that's something that could be done. The way that supervisors are selected is really important. The people management side of things is really important, not just the technical capabilities and skill. And then the way we set up supervisors and managers when they come into that role, that's really important as well. They need to be supported by a good environment. There's a whole lot of other opportunities there that might be relevant in your workplace. But I think that's really where the emphasis needs to be, is on creating a healthy and resilient workplace so that we can have healthy and resilient workers. So the final word then, anti-bullying policies and bullying awareness training, they're really important. They're fundamental for signalling that bullying is not okay, for helping people to understand what it is, for providing mechanisms for complaint and so on. But they're not sufficient for bullying prevention. We need to actually go one step further and tackle bullying as a work health and safety hazard. Now, a substantial amount of bullying in organisation actually takes place through these day-to-day work activities, these day-to-day areas of organisational functioning. And these can actually be risk managed in much the same way as physical hazards can be risk managed by identifying what needs action and putting some risk controls in place. So the bullying risk contexts in organisations, they can be assessed, and we can understand how and where to design out workplace bullying and create a mentally healthy workplace. Thank you.